Hey, thanks for doing this on a Sunday morning.
Absolutely.
It's a very challenging time for many people. And as we were kind of being shut down, I immediately thought of For All Seasons because I think you work with some people that are at the greatest risk when something catastrophic like this happens. And I guess I just wanted to get a quick report on how you're doing and maybe get into some of the challenges that you as an organization face during this crisis.
Yeah, well, and thank you for thinking of us and for thinking of the clients. I would say that, as an agency standpoint, I think we are doing really well. We've got a fantastic team that sees very much the need in the community, and we are right there as part of the healthcare community. And so our entire week has been spent putting plans in place to be able to continue to serve clients regardless of what's happening around us. And really trying to focus in on some self-care with our staff as well, because we know that folks whose schedules have shifted and are now home in ways that they don't have the freedom to go out to day programs or to appointments as easily, it's taking its toll on people's mental health. And certainly for those that have a difficult time in general, we are really trying to work to meet the needs of not only the folks that we're serving, but the staff, and making sure that they're able to take care of their families in the midst of this very unknown time.
So your offices are closed, or do you make exceptions?
So we are open for specific in-person appointments. Wow, I need to start that again. So we are open, and we continue to see folks in the office that need to be seen for either medication management or who don't have a telehealth capability. We've worked all week to be able to provide our staff what they need in order to work remotely. And so we've opened up the option of telehealth video conferencing for therapy sessions and psychiatry sessions. We also have been really pleased with how the state has responded in that telephone contact is also an option for our folks to be able to be seen. But all of our offices do remain open. Our folks have the choice to work from home, but we know that there's a handful of our folks who wouldn't be able to receive services because technology and or phone or whatever would be their barrier. So we are continuing to keep our doors open.
So do you have a sense of whether or not this has caused a spike in anxiety?
I think it's there for all of us. It's there for our staff. It's there for the folks that we serve. It's there for the folks that we might not serve. We have definitely seen an increase in our hotline calls and people needing to just talk. We've also seen a spike in sexual assaults in our area. And so we know that when people are cooped up at home and there may or may not already be domestic violence or sexual assault and abuse happening in a home, that this is a really heightened time for people, because there is not that daily release that we all have of going to work or going to day programs or being able to be outside. The sports have changed for children, and I have friends who have kids and they've been home all week with them, and even for those parents that do a really great job and don't struggle as much, it's hard to have your kids home, and it's just a change in schedule for everybody. So it's really a big readjustment time.
So in terms of this issue with domestic abuse, are there things that people should know that could help de-escalate or reduce the tension in a house, suspecting that one or two family members may become agitated by this new condition we're going through?
Yeah, I mean, I think it's really important for the community to know that we continue to serve the folks who need our services remotely. Midshore Council on Family Violence, who serves the domestic violence population, is also continuing to provide services from a remote location. And so our hotlines are there for people to talk. And I was talking with a friend of mine who's a trainer in New York, and they're in a total shutdown. And he said, encourage people to go outside for a 15-minute walk. You still need to keep that social distancing in mind, but you can be 6 feet apart from someone and take a walk with them. We don't want children playing on playgrounds. We want to really be mindful of the CDC's recommendations to not be doing things like basketball, but being able to be outside. Patty Quimby from Talbot County Humane Society went live this morning on her walk, and it was basically, hey, look at all the beautiful flowers as I'm on my walk. And so being able to actually remove yourself, and hopefully for folks that are in situations, it's a safe way to be able to remove yourself from the home for a little while. But we recognize that that's not going to be safe for everyone. So I would say continuing to reach out to resources and to continuing to do things like family games and working with your kids on homework or, art projects. Those are some of the ways that may be able to help sort of de-escalate and keep folks still connected, because that's the piece that's really difficult, is that we're all losing our connection.
What I also worry about, I'm sure you do, is people's access to their medication. Is there kind of a fast track where people can get what they need?
Yeah, I mean, so the medication piece, all of the mental health agencies, I know I can speak for all of my community in that, and that the medication is still available. And regardless of whether folks are coming into the office or whether they are being seen telehealth or through a phone call, we have a commitment as part of our healthcare community to keep the medication continuing for folks. And so, I had to pick up a prescription for a friend of mine this week, and I sat in the line at Walgreens for an hour and a half. But, the bottom line is the prescriptions are there. So it may take a little bit longer, and people might need to just plan a little bit differently for picking up their prescriptions, but prescriptions are still continuing to be there. Our office also offers injection type medication for folks. And so our psychiatry team is continuing to provide those injection shots in a really safe way, following the guidelines and making sure that our staff is staying safe in the midst of being able to serve the community.
Well, let's get into the more basic elements of this, of having to adjust to being closed in, and in some cases being with family members that you normally are not seeing
Right.
at this level of time.
Yeah. I mean, think about when we, even those of us that can say we love our family to pieces, when you are stuck at home for a couple of days on a holiday, tensions can be high. And as much as we love our family, in the best of situations, it's stressful. And so now we're in a situation, I said to somebody yesterday, it's kind of like Groundhog Day. Like, it just keeps going over and over and over again. Children, I think one of the most important things for families with kids is structure and a schedule. And so, I can speak for myself, working full time through all of this and having two children at home. It's been really difficult for me to be able to put that schedule into place. But we've been working with our family and the babysitter to say, okay, there's an hour of phone or screen time, and then here's the schoolwork that the school sent home. Everybody needs to be outside for the next hour. Here's lunch. So that's what children are going to thrive in right now. And it's going to help make the pattern for the day really a better structure for the family. And it's not to say that you can't have a day where everybody just lays around and does whatever. But I think in terms of keeping our children structured, and then, we're doing a really great job. I think one of the things that we've seen in all of this, as hard as this is, there's a million things that are happening that are bringing our community closer together. There's neighbors checking on neighbors, and children going over and taking an egg to next door, or, hey, do you need this? I'm going to the grocery store. Can I pick something up for you? And so if you can work some of those neighborly kindness moments into your day with the family, I think that's a big help. But we also think about, for single parent homes, there isn't that release. I heard somebody on the radio this morning say, take turns as a parent and, have the one parent take the kids at this time and you take them the next time. Some families don't have that option. So I think it's okay to say to your kids, mommy or daddy needs some time right now. And so, go read a book or put a movie on, and make sure that within the course of your day, you're getting some of that discharge time. I think that's the super important piece.
So wrapping it up, for at least for this installment, I hope we can talk throughout this crisis. But anything else that you want the community to know at this particular moment?
I think it's just really important that one of the things that I hope people take an opportunity to do in, you know, 2 weeks ago, our lives were completely busy and they were completely overscheduled. And so take some time to really just sort of take a pause and take a rest. And this is a really unknown time. And so we are all going through that unknown time together. For All Seasons continues to have services available to both our English and our Spanish speaking community. And we certainly want people to be utilizing the Eastern Shore Operations Center, the mobile crisis team if necessary. We want folks to be able to use our hotlines, be able to schedule appointments. We are still taking intakes. And so even though we don't have all of our staff in the office at this time, we are still continuing to onboard people for mental health services. So our operation as an entity has just shifted. We have not changed our services. They are just happening in a different way. And so we will continue to update the community and participate in all of our county calls and the state calls to make sure that we're following guidelines as we remain open to keep our patients and our staff the safest that we can be. But we're here, and there's lots of us in the mental health and the healthcare community that continue to be available for the community, and take care of each other and let us know if there's ways that we can help you, and know that we are right in this with you.
Thank you. I really
Absolutely.
appreciate it.
Yeah.